speaking of the team that you work on, so you work in an integrated clinic, and I think that was one of the, I don't want to say surprises in the book, but really, I think something that I had a new appreciation of from reading this book was the importance of offering care in the particular setting that you work in. So I was wondering if you could talk about that, like what's it like? Because I imagine that most people hear their experience of a psychiatrist sort of imagines a psychiatrist in an office or maybe in a hospital, maybe working with a social worker. But where you work, it's really different. So can you say a few words about that?
Yeah, sure. And I'm really glad you mentioned that, because I definitely feel strongly that we're really moving, into the future of what we want PTSD care to look like, and mental health care in general, to tell the honest truth. We really have to rethink the way we package mental health care. And so my research is, I'm a health services researcher, and that's really what I spend my time doing, figuring out how we can repackage what we already have to make healthcare, mental health care for people who need it more acceptable, more available, more accessible. And it always makes me laugh, because every single psychiatry clinic I've ever worked in England, in Wisconsin, in California, for some reason the psych building is always on a different campus to the rest of the hospital. Like, what is with that, right? And we're always like separated. It's like out of sight, out of mind. And I think it really feeds into this dichotomy, this artificial dichotomy between the body and the mind, which is nonsense, right? It's all interconnected. And so, to me, one of the best ways to increase access to care is just me simply move where I practice. So for the last 10 years, I've been sitting in primary care. That's where I see my patients. Because guess what? People with mental illness show up in primary care. By the time you refer people from primary care to the mental health clinic, half of them, you'll lose them. They will never make that first appointment. So I think we need to move. Psychiatrists need to move. Therapists need to move. And luckily, because I work for the VA has been the pioneer in this. The last 10 years, they've had a massive overhaul. It's still rare to find a psychiatrist who is in primary care just because there's fewer of us. But pretty much any major VA clinic, which is a primary clinic, which is above a certain size, has a full-time psychologist. And what does that mean? When the primary care doc is seeing their patient, they are required to screen for PTSD, depression, substance abuse, all the kind of common mental health conditions our population has. And if they feel that the patient is in distress or having a high level of symptoms, they can simply walk the patient to their colleague, do a warm handoff. The stigma level goes down 50% just by that alone. Because here, this is your trusted primary care doc, and they're handing you over to their trusted colleague. So for me, it's really rewarding because I feel like I'm seeing the patients I've always seen in my career. I'm just meeting them like 10, 15 years earlier. And that to me has been amazing because, as you know, untreated mental illness, it just gets worse and it gets very entrenched, and oftentimes it gets complicated. But if you can reach people earlier, you can just have such better outcomes.